Hey guys, welcome to my channel. I'm Dr. Jenny, a medical doctor living and practicing here in Nigeria. Here in this channel, we talk about health related issues. So if this is the content you're interested in, then stay tuned. Just subscribe to be part of this family, and also don't forget to hit the notification bell so that whenever I post any new video, you will know about it. Just like the popular saying that health is wealth. So if you want to stay healthy, then this channel is actually for you because it promises to be wonderful. You're going to gain a lot in this channel. So today we'll be talking about breast cancer. What did I say? Breast cancer. Breast cancer is actually a menace that can be curbed in our society. Yes. What's actually breast cancer? Everywhere you go to, breast cancer, breast cancer. What is this breast cancer thing all about? It's just the cancer that starts developing from the cells of the breast. So, but breast cancer, in as much as it affects majority the female, it can also affect the male. Yes, you heard me right. You can also have males with breast cancer, but it's not common. It's not common. It's more common in us female. So if you're a woman, you are not watching this video, then you're wrong. Okay, because we just want to discuss things that you should look out for, lifestyle that you should check very well to know if it's worth living, since it's going to be having effects on your health. Okay, first of all, we'll be talking about the signs of this breast cancer. Lump can actually develop in the breast. Some can be benign and some can be malignant. What do I actually mean by being benign? Benign is that it's not cancerous. Then malignant means that it's cancerous. So when you have a benign lump, those ones can actually be painful. You may have a lump in the breast that is painful and all that, but in cancers, they may never be painful. That's the bad thing about cancers. It might just be growing. So as a woman, you should always check for lump. Always do self breast examination. How do you actually do this self breast examination? Okay, I may not be demonstrating, but I will just be talking about it. Just use your hand, divide your just a kind of imaginary line. Divide the breast into four. That's the upper and the lower. The upper outer quadrant, the upper inner quadrant, the lower outer quadrant, and the lower inner quadrant. When you divide it into four, you can just use your palm to palpate. You check the four quadrants. Kind of, you can do it after bathing, you can do it in the bathroom, you can do it in your room when you're changing, but it's necessary. It's something that's why it's called self breast examination, because it's not just the one you go to the hospital to tell the doctor. You can't just come, you are not seeing any lump, you lie down or you carry yourself to the hospital. Most people don't do that. So at least this is just the little you can do for yourself at home. So you can just keep checking from time to time. When you notice a lump, even if it's cancer, is a cancerous one and it's being found out on time, you have a better prognosis than some other person that is finding out when it must have spread. One bad thing about cancer is the ability to spread to others. Is a very generous thing. It keeps giving out to others. Do you understand? The cancer might start from the breast. Before you know it, it has dashed small to the lungs. That's just the bad thing about cancer. So when you notice that on time and you go to the hospital, you will save so much, even money. Because when you're coming down with spread, the amount you're going to use to treat then can never be the amount you're using to treat when you're just seeing the lump and it's still localized. And even the outcome when it's still localized is better than when it must have spread to every other organ in the body. So today we'll be talking about that breast cancer. So you have to keep checking for lumps. That's the very common things that we see initially. Then later on, there could just be changes in the skin of the breast. There could be a nipple discharge, and there could also be you could also check your armpit. We call it the axilla, but I'm just trying to be as common so that everybody may understand and flow with me. You can also check your armpit if you can, after doing the breast examination, when you go using the 4 quadrants, then you also check the middle, that's the nipple area, and also try to express to know if you're going to express anything out of it. If there's a bloody discharge, it could also, I'm not sticking out my neck to say it's breast cancer, but it could also mean that something is going on in that breast and it could be a breast cancer. So when you, after doing the breast examination, you just press to check if anything is coming out. Some people may not even notice the lump in their breast, but the first thing they might notice is the one here. That's they will notice that they have some kind of lumps here. I'm feeling something in my armpit. That's how some people present. So you just have to be very careful. You just have to keep doing this from time to time. You that once you notice a lump, you do what? You go to the hospital where you will be assessed. After the assessment, we'll do some other things which I may not be talking about in this video for today. Do you understand? So when we do that, then we'll be able to say, oh, this is breast cancer, this is not breast cancer, it's just a lump growing and we need to take it off and all that. All those decisions will be made in the hospital. We're going to talk about now the risk factors of breast cancer. What are these risk factors? What are the things that you could be doing that will actually help in causing this? You know, I'm going to be breaking it down into 2 factors: modifiable ones and non-modifiable. Modifiable ones are things, habits that you on your own can change to help things. So I will start with the modifiable ones. You know, there are things, once you know that this thing is going to kill you, so why do you go ahead doing that and trying to know what the outcome will be? Like, seriously, if someone tells me this is going to hurt you, why am I going to go and try it and know what the outcome will be? I don't even want to try it at all. So those ones we'll be talking about are those ones that on your own you can change. So first on the list, I'm not using any particular sequence, I'm just going to be calling them out. First in the list, I'll be talking about alcohol intake. If you're a woman and you keep enjoying yourself, you call it enjoyment. I'm just using that word because that's what some people say. Maybe anytime you see men gather, you sit down and take 3 bottles. As a woman, you're destroying yourself. You are at risk of having breast cancer. Then if you're a woman, you keep taking pills to prevent pregnancy, you're also exposing yourself to breast cancer. Then if you're a woman, if you're an elderly woman, maybe you just want to keep looking young, then you're going for hormonal replacement therapy. Those you actually hurting yourself because you are at risk of having breast cancer. Then again, if you love to consume fatty things, that's just your choice. Anything fatty, it's also helps to contribute. Then I'll be talking about the non-modifiable factor. Those ones you cannot change it. Like nature has brought it to be, you cannot change it. As a woman gets older, it's more like you're going closer to your grave, and that's how your body is getting weak. The cells of the body can just start malfunctioning. So as you get older, that you have a more chances of having breast cancer. And you see that that's why I said it's non-modifiable. You cannot change anything about your age. Even when you tell somebody you're 12 when you're 30 something, yes, you've told the person a lie, but you cannot change it. Nature knows your age. So once you're getting old, greater than 50 downwards, you're tilting towards that, and you have more chances of developing breast cancer than the younger ones. But something is happening now. I've seen a lot of patients, younger ones, coming down with breast cancer. I've even seen 20 something. I'm telling you. So most times I ask myself, if all these ones that are 20, in their 20s, are having cancer, then I'll look at myself and be like, hey, what's happening now? We'll also be talking about reproductive history of a woman. When you're a young child and maybe you started menstruating so early, younger than 12, maybe 8, 7 or so, thereabout, less than 12, you're already menstruating, and you're having a late menopause. A late menopause, that's having menopause at maybe greater than 55 years, you have a very long chance of developing breast cancer. Because of what? There is increase in exposure of estrogen to that woman who started her menses early, and also it took time for her to stop seeing her menses. She has more chances of developing breast cancer than some other person who started menstruating late, and before 45 or so the person stopped. Also, if you're a woman and you're having your first child greater than 35 years, you have more chances of developing breast cancer than some other person that started having her baby maybe less than 30 or before 35. Then again, if you have a family member, a first degree relative, that's your mother, your sister, who has breast cancer, then you have chance, there are greater chances that you may develop breast cancer. I'm not saying it's a must to, once your mother has breast cancer, you start crying, so me, I'm going to, no, but just that you have a greater chance of developing breast cancer than someone who doesn't have any relative with breast cancer. Then if you have mutations of this gene, BRCA1 and BRCA2, then you have a chances of developing breast cancer. And also, if in your family there are people with ovarian cancers and all that, cancers of any form, you also have that chances of developing breast cancer. All these factors actually helps you, all these risk factors, to know what your likelihood of developing breast cancer is, so that you'll be more careful. What's the treatment option for this breast cancer? Is it a death warrant? Once they diagnose you of cancer, you now gats stay one place and die? No, my dear. Once you notice anything happening, just go to the hospital. The doctors are going to assess you. After the assessment, we'll do a lot of, I may not be calling drugs or anything, I won't do that, but I will just try to tell you the sequence of what you may go through in terms of treatment. I've seen people live years after being diagnosed of breast cancer. I am not joking. Years after being diagnosed of breast cancer. You can live even more than 10 years, 20, 30, depending. But remember, I said early dictation matters, because when somebody is noticing it when it's still in the breast, there's no spread and all that, when it's still a carcinoma in situ, you won't compare the person with another person who is noticing it when the person, there's a spread already to the lungs, spread to the spine and some other places. So if you have a breast cancer, you need to go to the hospital. And or depending, you could decide to see a general surgeon in a private place. That's fine. You might also decide to go to a teaching hospital. When you see a doctor, you're going to be assessed, and they will take a tissue from that breast to do a histology. That histology will actually show us if it's a cancer, if it's not a cancer. If it's not a cancer, we can just go ahead, book you for surgery, give you a date, remove the lump. But if it's a cancer, then we'll start our chemotherapy. Chemotherapy, we have what we call the neoadjuvant and the adjuvant. The neoadjuvant is those ones you give to the patient before surgery to downgrade the tumor. When you're giving those ones, you give them because you don't want, cancers bleed a lot. So you just want something that will shrink the tumors more. Sometimes, and I want to point out this thing because I've seen a lot of patients decline after chemotherapy. Maybe they started chemotherapy, they had their first cycle, second, third, fourth, and they feel that the lump is no longer there. It's possible that the chemotherapy would actually, you will not notice any lump again. It will seize the lump, like it will dissolve everything. You may not feel the lump again. But please and please, I just want to use this opportunity because one of our patients, I think that was, although she have started chemotherapy now, when I was asking her, she started sometime last year and she declined. So coming back this year, one thing with cancer is not something you joke with. You might just decide to do what you want to, but when it's coming back, it will come back in a different style. So coming back this time around, it came back with so much ulcer and all that. So I was asking her, "Mommy, why did you stop coming for your chemotherapy?" Oh, she said, "Oh, after that first cycle she took, oh, she felt so relieved. Probably she felt that the lump was no longer there. So why am I going to go and meet these doctors?" But please, that's why I'm stressing on this thing. Even after that new adjuvant chemotherapy, most people, not everybody, may not even see that lump again. But please, don't stay at home and think that cancer has gone. If you're booked for mastectomy, that's removal of the breast, please don't stay at home and think that that cancer has disappeared. Because what happens is that, just like I explained, when it's coming back, you may not like the after effect. You might come to the hospital needing oxygen, then being on chest tube just to drain the fluid in the lungs. All those ones, you now come with life threatening, in a life threatening condition. You may not actually like that. So just follow your doctors. Do you understand? If after that chemotherapy you can go for surgery, then after surgery we still repeat the chemo, and that one we call it the adjuvant chemotherapy. That's the one you give to the patient after surgery. That's the adjuvant chemotherapy. Those ones are just, you're giving that in case if there are any um seedlings, if it has sent some other little things, so that you can at least to some extent mop it up. Then you can also, depending on the immunohistochemistry of the patient, you can also start the person on hormonal therapy and all that. So this is all about the treatment. I'm not going, just like I said, I'm not going to be talking about any drug in particular, because some people are very funny. Then they might just go, "Oh, she mentioned this drug, she mentioned this drug, she said this one is the one you take, you will not see the lump again." Please go to the hospital. Cancer should be managed in the hospital by specialists. What did I say? By specialists, not just anybody handling the case. There's a lot to it, but I may not be talking about even the investigations you go for. I may not be mentioning those ones here, please. So, but just go to the hospital if you're noticing all these things in your breast. Thank you so much for joining us in this channel. We'll also be talking about other health related issues that is going to help you as a woman, as a man, as a child. Once you're a living being, then this channel is actually for you. I'm just being serious now. So you're going to gain a lot from her. Thank you.